welcome back to my Population Health Management series. I'm Siva Chandrasekharan, your Population Health Intelligence Consultant with over 20 years of experience in NHS and local authority organization. Last few weeks, we looked at the definition of population health management cycle, and we looked at the first pillar, segmentation. This video is about the data used in population health management segmentation. This week, we're going to look at the data usage in segmentation. First of all, we need to understand the healthcare usage and cost. So we need to look at the primary care services and secondary care services. Primary care, we're looking at GPs and community services, pharmacies. For example, number of GP visits, number of missed GP appointments, number of reviews done in GP surgeries. Secondary care, hospital admissions, number of DNAs in outpatient clinics, waiting lists in hospitals, both for outpatient and inpatient, A&E attendances and frequency of A&E attendances. Secondly, we look at the demographic characteristics of a population. What age group these people come for a GP visit or hospital admission or an A&E attendance or a review. What gender, ethnicity, these can have a determinant effect on the health of the population. And let's not forget ethnicity. Ethnicity plays a huge role in terms of tropical diseases, screening, immunization program, uptake, other things. So understanding the population characteristics is very, very important. In order to understand the population characteristics, you look at the ONS, which is a nationally available data set. ONS stands for Office for National Statistics. You have the 2021 census data. You've got, if you're a London-based population, you have the Greater London Assembly demographic population projections, ward level projections, ONS subnational projections on population growth. This gives you about the gender, age, and ethnicity breakdown of the population. And you also have got the registered population, GP practices from the clinical systems, you can get it, or from the GP extraction service run by the NHS Digital, you can get, or you can get it from the QOF, Quality Outcomes Framework data, which is available nationally from NHS Digital. The next set of data is from wider determinants, social and economic factors that affect the health of the population. This can be employment, education, pollution, deprivation, benefit claimants, etc., etc. Again, Normus Web is a very good site to get Office for National Statistics data from the census and local authority data collection in this site. You have Department for Communities and Local Government site available in the gov.uk website on education and deprivation. Deprivation, we're looking at the IMD domains, Index of Multiple Deprivation. There are 7 domains in IMD, and 2024 is the latest statistics available. So you can compare between the previous release of the IMD data, and then you can understand the variation in an area. DEFRA, Department for Environmental and Rural Agency. DEFRA gives you information on air pollution, NO2 levels, etc., which can affect your respiratory health. Education attainment from DFEE, which is also available in gov.uk website. So these social and economic characteristics can help you to understand the health needs of the population. So we have pretty much covered most of the data sets. Last but not least, surveys. There are local surveys as well as national surveys. Health Survey England is a national one. Active People Survey for Sports England is also a national survey about physical activity and health condition, etc., etc. You can also commission local surveys from a local authority. Annual Public Health Report is another data source run by local authorities public health teams every year on certain topics. You have your JSNAs, Joint Strategic Needs Assessment, delivered by local authorities, who can give you loads of information about not only data but evidence based from various experts. You collect all this information and data and determine your segment to get a better and successful health outcome. So stay tuned in our population health management journey. Please remember to subscribe, like, comment, and share this video if you find your colleagues would find it useful. There are more links below for other videos in the description and also other sources. Remember, be happy, stay healthy. Thank you for listening.